turning the recording on. All right. So welcome to a very exciting edition of Talking Data Equity. My name's Heather Kraus. I'm the founder of an organization called We All Count, which is focused on building tools and community around breaking through the myth that quantitative data is value neutral and figuring out ways that we can, in practice, align our equity goals with our data projects. And frankly, the highlight of my week every week is this thing we do on Fridays called Talking Data Equity, which is a chance for anybody in the community, anybody who's interested, to gather and have an informal, concrete, honest conversation about the work of data equity. And sometimes we have topics and sometimes we have special guests. And this is our first time ever of having a repeat special guest. And it is by overwhelming demand that I am very excited to tell you that AJ is back with us. Dr. Paris Adkins-Jackson is back with us. If you missed the first time she was our special guest, go back into the community forum and watch the video. It is amazing the amount we managed to learn and talk about in that 60 minutes. Dr. Adkins-Jackson is at Columbia University, where she's a professor and a researcher. She works in epidemiology and socio-medical sciences at the Mailman School of Public Health. And we will put lots and lots of resources into the forum so that you can learn all about it, but I will stop talking now so that you can do what you really want to do, which is hear from AJ. So over to you, AJ.
Thank you so much.
Hey. Oh, I forgot to say, she's in Harlem today. She's not in California this time, madly trying to get on a plane.
Yes, I am in bougie Harlem. I always have to qualify that. I live in bougie Harlem. So I have things like I was discussing earlier with Heather, how I just discovered that my tree lost its leaves. I never look out this window, but today I did. And I was like, what happened to the leaves? I am pretty sure other streets don't have leaves or trees. So I do live in a very uppity part of Harlem. There are green things on my block, so I want to acknowledge that. Yes.
Awesome.
But I'm here in New York. If you're in New York, holla, but from a like 6 feet different distance because I'm a germaphobe. There are no slides today. I am here to gossip. So let's get into it. Does someone have a pressing thought, question we want to start off with? Spill the tea. Yeah, spill the tea. Okay.
So I have a couple of questions that people submitted going in, but if anyone is in the room and wants to ask a question, because we have a couple hundred people, we're just going to ask that you raise your hand and we'll just unmute you in the order that you raise your hand. And if you don't want to unmute, you can put your question into the chat. So one question, AJ, is for people who weren't here before, would you summarize your work in a couple of sentences so that people will know what topics they can ask questions about?
Sure. And I'll work it in as we sort of talk. So I measure the impact of structural racism on aging. And I use a multidimensional model of structural racism that both works and does not work. If you want to gossip about those intricacies of it. I also do a lot of work around data equity, who can own data, what are sort of the wisest approaches to working with racialized groups when it comes to counting people and data. All those things are sort of on the table when gossiping with me, in addition to just all around being very community-based and focused on data sovereignty.
Perfect. So absolutely, the answer is resoundingly yes. Would you tell us, because a lot of the writing questions were a follow-up to some of the work that you shared about
Are you fucking kidding me?
actually measuring systemic racism rather than just using somebody's race as a proxy for experiences of racism. And I think we touched on your work in academic health centers. So if you can tell us how you are measuring racism in academic health centers, other than just counting the number of people of different races or different skin colors that are included.
Okay.
How's it going?
Absolutely. Absolutely. And I'll tell you how not well I do this, because I'm going to be frank with you about how this works. So I use this sort of framework that comes before me because I truly believe that all of us are needed and important in conceptualizing this big problem. So I don't invent anything novel. I literally just listen well to what people have said before and try to implement it and learn from it and then suggest what we should do. So I take sort of Derek Griffiths and a lot of people from psychology's model of institutional racism, and I implant that in the middle of structural racism by saying that in order to capture the full system and how it's operating, we also have to study each particular institution and organization as a part of it. And I use Pinocchio to depict that every wooden part of Pinocchio makes up this system of racism. So academic health centers make up a huge portion of structural racism. And so how do we capture within academic health centers how they sort of participate in this sense, in this system? So I use this multi-tiered approach at the interpersonal level, the interaction between providers or healthcare workers and the individual. We're looking at disproportionate time spent, issues in communication, whether or not the patient feels like they're really being heard or listened to, whether or not they're being recommended for clinical trials, procedures, certain medications. How are these decisions sort of coming down to the individual level at this interpersonal exchange? Then at the next level, you have within that organization its own policies and procedures. One of the ones I think are interesting are often if an individual has this particular outcome on their blood, then you automatically recommend something. That might seem like a medical decision, but as we're seeing with a lot of these papers that are coming out, they're really based in this algorithmic bias that encode your racialized group into it. So it says, yes, you have this blood level, but you're also Black with this blood level. So then we prescribe this kind of medicine to you. That's an institutional level policy and decision that they are implementing. That also comes down to like the resources that are available in particular units. Sometimes I scrutinize academic health centers if they are serving a largely Black and Latinx population, but don't put a lot of money into their endocrinology program. It's like a lot of the conditions at the root come from endocrinology issues. But if you're defunding that and you're putting all your money into other areas, that is a strategic level decision of that institution to be complicit in the problem. And then each of those institutions have a maker, right? You have HHS, you have all of these other organizations, AMC, that feed into the decisions that get made at the organizational level. I always remember this one policy at a couple clinics in Los Angeles where it was a first come, first serve policy on free care. So you can get this particular test, I think it was a mammogram, but it was a first come, first serve situation. They didn't advertise it, they didn't tell anyone, but this was their way of translating the state level policy around these funds that were given to them, because the funds were for a finite number of people. So then the clinic decides this is a first come, first serve, not a need-based system, not if someone asks about it, like none of that, which is first come, first serve. If you happen to roll up in here during a work day, If you happen to take the time off and had the time to take, and you came up in here and something related to it provoked the provider to tell you you should get this service, then you got it paid for. It's like all of those kinds of decisions that get made are differential, because if you're going to send funds to a low resource area, why would you have the caveat that it's first come, first serve? There are so many other systems you can implement if it's need-based. So I connect all these levels together to then say, are they feeding into each other? Where are the issues at? And this is what we need to target. I'm also reading the chat too, so.
Okay, great. I'll just let you pick out of the chat what you're interested in talking about. There's lots of options.
Sure. All right, let me jump into something you said earlier, and then I'll try to beat this into algorithmic bias. So my colleague, Bridget Davis, who is a postdoc at University of Minnesota, this is one of her bones to pick with measurement in general, is with count data. So this comes down to how you work it through in your brain. And we really do have to work it through in our brains, right? Like there's no right or wrong answer. So you got to kind of make peace with there being no right or wrong answer, that our job is to do things in the wisest, most ethical ways that we possibly can, but that may mean that we change it.
Right.
So we make peace with that. Yeah, that sometimes we get hold up. People are like, well, we figured this out 20 years ago. I'm like, okay, but now we're in this year and that is a problem. So now we need to revisit it. It's okay. We'll all be okay. So her thing about count data, and I can attest to this, is if you're not familiar with this metric, it's called the Index of Concentration, ICE. And what it does is it takes a disadvantaged group, a group with advantage, subtracts from them a disadvantaged group, and then divides this over the total population. So you might have the number of people racialized as white who own a home minus the number of people racialized as Black that own a home over the total population of people who own a home. It will give you sort of this interval, -1 to +1. -1 means there's more people who are disadvantaged. +1 meaning there's more people who are advantaged. The problem with that, when it all comes out, and that I've been seeing, is that you'll get areas that have more people from the disadvantaged group. Like your measure will look like it's not racist because it just has more people. So it'll be like a negative value. And you're like, oh, okay, it looks like, it's more equitable. It's not more equitable. It's only because you're counting physical people. So you can be in a radius together and not have access to resources. I think New York teaches me this every single day. I walk out the house. You could be literally on the same block and not have access to resources. So counting people may not be the best approach, to Bridget's point. And so when I use ICE or when I use similar kinds of metrics where you just count people, I'll throw this one out at you. States like Mississippi, Georgia, and North Carolina look anti-racist. They have high populations of Black people. If you're only counting people, then those states don't have any racism. But what does history tell us? What do the people who still live there tell us? Like Mississippi, in my state level measure of structural racism, has the lowest racism score. That's what told me that we had a problem, because I know they're having a water crisis right now. And it's the same marginalized groups that don't have access to resources. But if you count the people, Mississippi is on par. They're doing it over there. So to Bridget's point, maybe counting the numbers of people aren't the most strategic approach to things. I think this is certainly the case when it comes to socioeconomic factors, like the number of people educated, the number of people who make a certain income. Those things are just problematic when we use count data to it. But, and this feeds into algorithmic bias, is it possible that that kind of count data in a clinical setting is appropriate to actually capture? Because how else will you know where the bias exists? So maybe you do need to see whether or not, whenever you plug in these particular parameters into this sort of algorithm, does it give an overwhelming majority of people racialized a certain way, certain kinds of outcomes? Do they get a certain medication? Do they get a certain procedure or not a certain procedure? So when are count data actually helpful? And then you have to complicate that whole conversation with, how in the hell do we count people?
Right.
How are we going to do this? Because we have taught people that their identity is a racialized group.
Right.
And so people now are attached to that. So how do we're now in a different kind of system. It's no longer someone projecting onto you, you are this group. Now people wholly see themselves as this group. Is it respectful, ethical, moral to tell them no? Like I struggle with this one a lot, especially with ethnicity. Like, oh, that just boils my potato. Telling somebody that they are an ethnic group when they don't know them people over there, okay? I have barely seen people racialized as Mexican from one region talk to the other region. Now they a whole group of people together with a whole bunch of other groups of people together, and they somehow all one people? This is the weirdest phenomenon, right? But if you're being excluded in a society by this way of grouping, how can I tell you not to self-identify as Hispanic, Latinx? Like, how can I push on that? So now we're in a different kind of conversation. It's no longer just about self-report. It's no longer just about identity. And that's why I lean on the framework of saying it's about equity. So in my surveys, I mentioned this last time, I will have a whole paragraph that says, hey, due to racism in this country, this is historically how someone like you might have been seen, but that is not who you are. Who you are is how you define yourself. So you have the right in this survey to help us capture historically what has happened to people like you, or you can decide to identify however you want, because you are worth more than this survey data. But, I know everyone hates it when I do that in surveys. They're like, stop doing it. Stop. It's gonna mess up our stuff. And I'm like, look, I don't care. I can't sacrifice people's dignity and identity and sense of self for some data points. Maybe Bridgette's pushing us to go stop counting stuff is our way of getting out of measuring people. Just a thought.
I think that's a really important thought. I think that is at the heart of what we're trying to figure out how to do and how to ask exactly what you're saying. Like, is it ethical or moral? Is it good for equity to do what often the first impulse is? Like, so many people are like, I'm going to be equitable, so raise your hand if you're Black.
Mm-hmm.
Like, what?
Mm-hmm.
That is not data equity. Have you ever tried to ask a different kind of like experience question? Like, not like what is your background, what is your history, what is your identity, but like what is your experience of something? Like, do you ask experience questions? Like, do you ask questions like, have you experienced racism in this medical setting, or have you tried any of that? Do you have any thoughts if that's going to work or not work, or just double down on the stereotypes like everything else?
I have not, but I do have a thought about it. I feel multiple ways about this. Like, all right, here's completely my bias as a doctoral level educated woman that now is not broke. I find that people are not thinking about the intention behind how they were treated. And so when I rely on them to tell me their role in society, or whether or not they thought something was racism or sexism, I find people are not reliable. People will, whether it's internalized racism or some form of hope, people will tell you that it was something, oh, I just think the doctor was a jerk. Oh no, I don't want it. It's not about that racism stuff, you know? I've had elders tell me, no, I've lived through real racism. So what that was not racism. Okay. And I've had elder cisgender females say the same thing to me. Like, look, you haven't seen sexism, honey. That wasn't nothing. Okay. The doctor's just full of themselves. So I think we have to put the onus somewhere else, because we are relying so much on people to recognize what's happening to them, and they're busy. Like, is it really our job to force the embodiment of what they've been through to come out in their response to a question? Like, is there no other way? Do we lack that much creativity? Or are we unwilling to say to ourselves that we are complicit in the problem because we don't know how to change the system? And if that's the case, then I think we have to ask some further questions of ourselves, like, how do we do no harm if we can't do good? It just makes me, that I think that's why I avoid asking people like what they thought, because I'm like,
yeah,
as they tell me, they're like, girl, that wasn't nothing.
right.
I just didn't eat breakfast this morning. I'm like, child, no, that was racist.
Right. Yeah. Yeah. And I think you make a really good point about where we put the onus. Like, how does research continually put the onus on people who are marginalized, oppressed, various things to document that, rather than putting the onus on the person and the system that's doing the oppression, that's creating the marginalization, to document it and correct it. You know, it's not a patient that's experiencing racism. It's not their job to decide whether or not it's racism or to fix it.
Or, I mean, I like this comment by Amy. It's like, how would I even know how they treat another group to compare it to? Sometimes we're hypothesizing, right? Like, if I were this, you would have come quicker. It's like, you know, but we don't know what that treatment is like. So we don't know. So that's a great point. It's relying on people is an interesting, it's our way of working with the system that we have. But I think some things are a matter of history. So that's what I said last time I was here, is that I feel like people lack a very solid understanding of history. And this is why we replicate things that we do. For example, do you know what department the Census Bureau is out of?
It's something economic, right? It's like Treasury or Commerce.
It's the Commerce, isn't it?
Yeah.
You built a system to monitor the population out of a Department of Commerce. It just goes to show you where sort of the value of population estimates are. It's rooted in in this materialistic, capitalistic system that we have. And so what if we demanded a change to that? Because I think we just keep being like, oh, the census is so big, it's so big, it's so big. But there's not a historian of the census that doesn't come up with some racist ideology of many of the founders of how we actually do population estimates. It's like, this is ridiculous. This system is really, it needs slashing and burning. Like, we need to advocate for something different. And then maybe we can conceptualize something else, but it can't always be the onus on individuals.
So have you tried to measure a system?
Yes, auntie.
How'd it go?
Oh man. Why am I listening? I'm here. I'm not even Christian, but I'm hearing this. I love gospel music, so I'm hearing this Christian song say, quitters never win. And I'm thinking to myself, man, I gotta stop being a quitter, because I get so frustrated when I interact with these hospitals. So this is how it goes. I will reach out, or a hospital will reach out to me and say, hey, we want to start capturing health equity within our system. I say, absolutely, I got you, no problem. This is the procedure. They're all excited. Administrators get involved. Diversity committees get involved. We might even put together a good survey. I always say survey the staff. I never say survey the patients. I never survey the patients within organizations, always the staff. And then this last hospital got all the way to the IRB and pulled the plug. And I wasn't surprised when I got the email that was like, we're having second thoughts. Understood, because this happened maybe like 4 times to me.
Yeah.
I even had an organization collect data, and after they saw the data, pull the plug.
Really?
Thank you for your time. And I always make agreements with them, like, I understand, I'll work with you. I'll say, I have certain rules, like if we're collecting data at your organization, then the IRB goes through my institution. All the data comes to me. I will anonymize the data and provide you a data set for your purview, but this is to protect the people in your organization.
Right.
Everything comes to me.
Yeah.
So I'll create all these controls, like we'll go through the data together. We'll put together the report together. Oh, there's no need to publish. Oh, we don't have to publish. This could be for you and your stakeholders. Like, it's okay. We don't have to embarrass you. I got you. But when that one hospital saw that data, and that was just from their staff, pulled the plug.
Wow.
Like, thank you.
What kind of things were they asking their staff?
We covered everything from promotion to conversation. We had scenarios around how people looked, how people spoke.
Oh.
And the goal was to connect those kind of things to the outcomes in the patients.
Oh, wow.
Because this professional is dealing with this much internal oppression, this then has this outcome downstream.
Right.
We couldn't get to that, because I was trying to help them to think about how, if you don't create a great environment, it really does show up in how you treat the patients. And they were like, oh, well, we want to examine that then. Great, let's examine that. And when they saw how many of their staff members were unhappy and felt like they were in an environment that was very discriminatory, they said, no, thank you. That's we thought it was way fewer. I remember one administrator was trying to tell me, well, how are we going to differentiate between them having a personality problem and them actually being discriminated against? And I remember telling them, you know what? Well, let's check the data.
Yeah.
And those scenarios they were talking about are those microaggressions everyone always talks about. Coming to work and people got to say something about your hair, about your outfit. I used to work in an environment at an institution on the East Coast, we ain't gonna talk about who they are, where every day, people would come to my office and comment on the fact that I didn't keep my lights on. I barely know you work, AJ. No lights. What does that have to do with my work? Don't like bright lights. But those are the kind of things that just mount up and affect your workload. And then now they have something to use against you. But these are these internal discriminatory environments that just trickle down into the people we interpersonally interact with.
Do you think that same approach would work in an educational institution? So instead of measuring students, you measure teachers?
Yep. Yeah, we had thought about this when I was at UCLA, when I was a postdoc at UCLA with Dr. Chandra Ford. We had kept talking about potentially doing some kind of internal thing across all the UCs, where we would capture those kind of things. And I think you would really see it because it's not just internal to your staff, but you also have students making comments to you about how you look, how you are, all of these different things. And then when I just want someone to be brave enough to do this with me, because I'm telling you, I know that is going to be correlated with some of these other outcomes that you see, like promotions.
Right.
And who ends up in certain positions. I mean, we have all the qualitative data on that, but we don't look at that pipeline.
Okay, tell me again the pipeline, because I think there are people here that are brave enough to do this with you. So what's exactly the pipeline that you want to study?
Absolutely. I think that the allocation of resources and the sort of, what's the right word for this? Not the rules, but the regulations set from wherever we receive those resources, then influence the decisions made within each organization, because those are the values. So those, like things like HHS, things like the education department. Oh God, you remember when we had that one person? Oh Lord, all of those decisions carry with it these biases. Like we will bias against people who are racialized in this way.
Right.
We will bias against people who have these gender identities. We will bias against this kind of sexual orientation. We will bias, like it's inherent in these policies that come down. The institution then implements it. So then we have to start at that institutional level to capture how it's being implemented, because they're making the decisions. And then that will trickle down to the outcomes you see, your retention of students of color, your any of these satisfactory surveys you get around climate. All of that stuff will trickle down into people's experiences on campus. That's my theory. I just want somebody to do it with me.
Okay, well, I have some emails being direct messaged to me. And not only that, but I also have people who are saying that they want to test this theory in government. Absolutely. What do you think this would look like in government? What's the pipeline there?
You know, I had a judges, I don't know how to say this, because these court systems are so complicated. So it was a New York court system, but it was like, it wasn't in the city. I can't remember how to actually say this because their court systems are so confusing to me. But I actually had that happen where a whole district invited me to come talk to them about equity. And we chatted during that time about what this might look like. And I pushed them to not do don't do the newsletter thing, right? Where you send out announcements over email. Like, no one should be discriminating against anyone. Please come to the Title IX office. Don't do that approach, right? Like, actually collect this information from your staff, from the judges, and then churn the data and then design very targeted conversations within your unit addressing these particular things, because that little email makes no one feel safe, right? The bully gets the email, the narcissist gets the email, and then they redirect their energy. They're like, okay, great, they're on to me. let me see how I can mess up their life in a new avenue. Like, it's not helpful. But it definitely can be applied. Absolutely. I think you will, if you see that internal system, it more likely will predict the kind of sentences you see in the actual criminal cases that they have. The way that, I mean, I think this particular court was worried they were seeing disparities in their family separation.
Yeah. We certainly have that in Canada. We don't have to count it. We know that it's happening. We're trying to fix it.
Yep.
Somebody is saying an interesting question that a couple people plus one. Do you know anything about the Civil Rights Data Collection, CRDC? Do you know anything about that? What's your opinion about that?
Yeah. No, it's very helpful. I mean, data, I mean, nothing is perfect. But I am familiar with that data collection, and I've seen a couple studies using it in my field in aging that I think is strategic. So the point is always to figure out when we deploy certain approaches. So if we presume, it's not to say, because people will say this to me like, well, if you have the lived experience of racism or sexism or homophobia, like maybe you shouldn't be at the table because you're biased. Yeah, no, people will say that to me, and it's because they believe the story that the world, the way we implement logic is objective. Like they wholeheartedly believe that. And so they figure that if you are not of this group, then you are more objective. Whereas there's a contingency of us saying like, nah, that's not what it is. What it is that we see things that are happening, like we see the mechanisms, we see the interplay between factors. And so if you work with me, then I can help you see those things. But then also when I get too close to it and I can't see anything but it, I have you next to me. That's why we say things like interdisciplinarity, work in teams, not just, you know, my school does this a lot. I make fun of them in faculty meetings and no one likes it. But if something comes up and they're like, oh, interdisciplinary teams, and on it is like one person from environmental health and one person from epi. And I'm like, who said that was interdisciplinarity? Like, we in the same school, come from the same schools of thought, like,
right. Yeah.
Logically, we're alike. How are we even interdisciplinary? Can you talk to somebody downtown? And they're like, downtown? Who goes to main campus? No one goes to main campus. But that's where the interdisciplinarity is, that community partnership where you really have to work through it. And you have the team with you that's like, yeah, you might be in the weeds. Come on, AJ, let me pull you back. You're not seeing the periphery. And then I'm like, thank you, because I was really into that, because that was what happened to me last week. So, but if we work together, I think we could cultivate research that is as close to objective as was this title was meaning to portray.
Yeah,
and that's the goal.
I think so too. I think if we work together, we 100% can do that. And we actually are doing it, because right now, like, the history of quote objectivity, especially in quantitative social science, is a hidden synonym for the white male academic gaze.
Yep.
And we have to drop the pursuit of that in order to start producing good science. And I do think that almost everyone here in this room today is aligned around that like this idea of continuing to throw resources and leave people out of the research design process, the research interpretation process, the mathematical model building process. Like, it's so gatekeeped by this idea of like objectivity as hidden white male gaze.
Or sorry to cut you off. Go ahead.
So easy. No, you go.
I was going to say, and that I think so my colleague this morning called me mad early in the morning because he's trying to get me on a grant that I keep saying no to. And he keeps saying no because the premise of the grant is that education makes health better. And I told him, you know, I was in academia in another capacity for 14 years. And I don't believe it. I just don't believe it. Education is a proxy in our society for access to resources. And so it's not so much in the field of aging for me that education is creating cognitive reserve, right? People will say, I don't think that's possible. What I think is possible is that the strain of not having whatever rule got arbitrarily set in the 70s means that I have more stress and strain in my life. And that leads to the disparity in outcomes. Not that you got some superior education that protected you. And so because of that, I'm like, I'm really not the right person for this grant because I don't even believe in it. I believe healthcare, everyone deserves. Everyone deserves good quality health. Education, look, you can be a genius and never even have a degree. And so I find that inner logic of education and this superiority creates these issues with community partners, right? Because I had a meeting yesterday and a scholar in the meeting was like, well, if we're making data decisions, do we invite the community partner? And sort of the air of it was like, well, they're not going to understand what's happening. So why would we invite them? And I was like, well, let me back up to your intent for doing the study. Like, was your intention to just deploy a community-based participatory story because that was going to look good with your colleagues at work? If that's the case, then I think you sort of have your answer because you're moving like that, right? That's how you're moving. Like you just added them ad hoc and it was never about really engaging them and making change. But if your goal really was change, then you treat your partner like a partner. And that means you have dialogue with them. I mean, I've done it where we've had like rapid data decision meetings, and then I have a follow-up meeting with the community and say, before we actually submit anything, let me walk you through everything we talked about. This is what this means. This is what that equation means. This is what this finding will get us. This is how we can use that finding. I will tell my collaborators how to use publications. Like, I mean, it only does us a benefit to have community members on the pub. So then I have to go back to my community collaborators and go, this is how we use this publication, okay? We're strategically going to insert this into the white paper or the report, or you're going to show up to the policymaker's office with this publication that says that this is what was found. Like, let's mobilize around how to use these things. But that's if equity is really your goal, then you become flexible in how you pivot because you're achieving something greater than just the mandates of the job. Sorry, I know I can always sound very, I should have been a pastor's child or a comedian. I clearly missed my calling.
Oh, I strongly disagree with that, but you can be more than one thing. I think actually in many ways, science is a religion and we need more science pastors like you.
I agree. I used to tell my anthro students that I said, science is nothing but a religion. You just believe that all of us doing this work, what we find is actually true, but you didn't do those measurements. You didn't do those statistics. You don't know. You just have to believe that our training provided us with the insight to tell you what is what.
Right. And how upset somebody gets when they think you're doing the ritual wrong.
Oh, yeah. Oh, that's
you're taking the Lord's name in vain. You're taking the p-values name in vain.
Such a good one. They do. That is such a great analogy. Oh my, I'm gonna have to borrow that one because that is
it's yours.
I cannot take, I was making fun of my colleagues because I'm in epi, but I have like anthropology degree, biostats, all this stuff. And in psychometrics, we don't rely as much on p-values. And I remember the last time I was really doing stats, everyone was in an uproar about trending in significance. They're like, oh, we hate this term. Like, what is this? And then now I'm in an epi department and my colleague wrote something and sent it to me that said, there are signals of association. I said, Lord, how is this different than trending in significance? This is the most hilarious stuff. But we do come up with these terms that we treat very religiously and get very upset with each other when we don't subscribe to it.
I like somebody's putting in the chat, or if you dare to choose Bayesian over p-values.
Oh, yes. Oh, yes. Oh, yes. I mean, everything should be at our disposal. It's all about the thought, the spirit, the love that you put into the decision making. And that's why it's flexible to take it back, because then you can go, okay, I deployed it, right? Like I told you, I deployed ICE. I literally looked at the data and was like, how is Mississippi and Georgia
right
least racist states in the United States? I think I have gotten something wrong and I need to go back and relook at what I've calculated. And I calculated it multiple times. And then finally I had to, tell Bridget that she was right. You were right all along.
Awesome. All right, we're almost done. Okay, go ahead, unmute. How do I pronounce your name? M-E-I-E-S.
I know you say that. It's Mish.
Oh,
I should
Mish.
write in there. Mish rhymes
Oh,
with
Mish. You know what? My Post-it fell off.
This is a judgment-free zone. Actually, it's Friday, and I should write in there. Mish rhymes with quiche. So I want, if you wouldn't mind, AJ, walking us through what you do in our gossip group, where, not bad gossip, we're gossiping about science, where you show how, if you have a theory or an idea, you have a way that you walk it through so that when you're approaching it, you're actually like, oh, I hadn't thought about that. Would you mind doing that?
Sure. So Misha is talking about Marvin Gray matter. So we have this group called the Marvin Gray Matter family, and we gossip about measuring structural racism and how to capture it underneath the skin. And so I often start off by telling them, like, we're gonna make a couple assumptions, but I want you to push back on those assumptions. And some of those assumptions are that structural racism is made up of two processes: the racialization process, where you assign a value to a group, and then the discrimination process, where you then differentially provide resources to that group based on the value assigned to them. For example, Black, white, Latinx, whatever the case may be. That's a value system. That's not actually who the groups are. It's a value system. And then you differentially provide resources based on that value system given to them. If we assume that's what it is, and then we assume that you can expect to see it at multiple levels, at that interpersonal, the intra-organizational, the extra-organizational, if you expect to see it between institutions and organizations, like the school to prison pipeline, where you have multiple institutions collaborating together in order to produce inequities, then if that's what we expect to see on the exposure side, then I want you to walk through a sentence where you connect the dots from the exposure to the outcome you expect to see. And it might mean that we make the assumption that because the exposure is differential, the outcomes are differential. I think that's some of what we're fighting with these days in structural racism, especially if you're testing white supremacy, because you might think everything is a one-to-one, where like Black health is lower, but white health is going to be better. In some cases, white health may be better in a whole different outcome. It might be poor in another outcome. Might not be one-to-one comparison. So nonetheless, if you believe there's going to be differential outcomes, how? Walk through the sentence. And I was pushing Mish this particular day to literally connect the dots from like farming disparities to consumption of food, access to food, to these kind of more biochemical responses you might see in the immune system or in the endocrine system, and then how that shows up in an actual health outcome. And when, because I will push, I'll be like, all right, well then talk to me about history, because don't assume the disparity is going to occur in the 2000s. Maybe that disparity was set in the 60s. And you just living out the historical effects of that. So then get real critical about it. When did the exposure happen? Is history relevant? Is the age relevant? What else do you need to, is the pathway relevant? Structural racism carries pathways of access, pathways of violence. Does that matter? Is it interacting in the body at different levels? Pollution is one of those things that's really hard for us because, I mean, you can have all these other things you combat, but then pollution gets in the picture and your body's like, I quit. I give up, I can't do it. So I make her and everyone else and myself. It's not just her, because I'll be on myself too, like, man, I have to connect the dots in the sentence so that people clearly see the pathway to the health outcome.
That was a great question, Mish, because that was super helpful. Thank you so much for asking, for knowing the question. Do you have a follow-up question that you want to ask Mish?
No, I asked that question because AJ makes it sound so simple. And even if you understand the dots, and then when you write your theory and you start to delve a little deeper, and this is even if you really have a handle on things, that in particular, structural racism is insidious in how it's difficult to quantify if you're not connecting the dots. And so she really does it, and that's why I asked it, so that you could see that there's a lot of intention and science behind the work that has to meet a level of, it has to meet a criteria, a very high criteria, in order to actually be valid. So that's why I asked it. And
Or
plus,
to be,
why suffer alone? No, go ahead.
no, I would say not valid, but to be strategic. I have a high bar for it being strategic, because we have so much power in our intellect. If this is what we were given, if this is the path we're taking, then use it strategically. And so if we're going to go to communities, I mean, this is why my whole structural socioeconomic racism stuff got halted, because of those values I was seeing in Mississippi and Georgia. And I was like, this is a problem. What we will not do is open our mouths and say something that is harmful. No, we will start from the beginning and get it right, because we have power to help. So let's help and not cause confusion. But that's me. Like, maybe, I mean, you ain't got to deal with me.
All of us. That's all of us, but better said than I think most of us. Myself for sure. We unfortunately, I have the very, very unfortunate job of telling you that our time is up. And I already know by the amount of responses in the chat and the claps and the hearts, it just means the world to us that AJ, you were willing to again spend another one of your extremely valuable hours, especially knowing how committed you are to not just, to doing things that matter and to doing things that are strategically important. The fact that you felt that you could spend another hour with this group means the world, and we don't take it for granted at all. Thank you so much. I cannot tell you how many names, the private emails that I have been given in the last hour of people that want to join you and form this research and do it. So I will be following up, and we'll see who's how we're going to do this research. We have this might be the day that an important, hopefully, measurement plan or research plan got born. So mark your calendars. We will all be following up. Have a great rest of your day. We are back again next Friday. Honestly, my mind is so blown by today that I can't remember who our guest is. I'll just be super honest. There is a guest next week. I don't know who it is. I'm sure they're very good. But AJ is here with us now, so it's all I can think about. So have a great rest of your day. Enjoy the Rihanna concert with the football game attached on Sunday. And hopefully have a great weekend. Thank you for coming. Talk to y'all later. Bye.